And this here, guys, for God's sake, nursing technician, they killed patients with a substance that leaves no trace. It's already happened. There was even a series about it. I said it was a bad idea. They put a series about it on Netflix. I already warned you. And what surprises me the most is that it's the hospital where I worked, in the intensive care unit where I worked, here in Brasilia, in the federal district. Man, seriously, I'm going to read the article, but for God's sake, guys, look at the stage we're giving to our profession. Look at how much nursing is being seen. Look at how much nursing has been noticed lately. We're only in January, not even halfway through the month yet. Look at what's coming up. What kind of technician? They were killing people. Man, seriously, I'm not even going to ask you to like and share because man, this is just crazy, right? I'm not even going to ask to play the intro. No, guys, I'm just going to read it here. The civil police of the federal district is investigating the actions of nursing technicians suspected of causing the deaths of patients inside Anchieta Hospital in Taguatinga by administering a substance considered lethal and difficult to detect in initial tests. The crimes took place in November and December of 2025, that is last month and the month before. In other words, it happened recently and they are being treated as homicides. The case was reported by the hospital itself. Guys, a hospital, for them to report it, things must be really serious because usually, for anything, the hospital doesn't want to make headlines since that's really bad for the institution. But look at the level this has reached. The hospital itself reported it, so you can see that the situation is even worse than we think for a hospital to report something like this. Guys, they're putting themselves out there by saying, look, we have a bad apple here and a really rotten one. Man, this guy, he's taking lives in the hospital. Imagine the credibility someone has now, even though that's the point. Rebuilding an image is hard, but destroying it can happen overnight. Imagine the credibility that nursing will have in this hospital now. Look at how bad this is for us, for our profession. Look at how terrible this is, but let's read here. The investigations are part of Operation Anubis, conducted by the Coordination for the Repression of Homicides and Protection of Persons. And they indicate that the suspects allegedly used potassium chloride applied directly into the victim's veins. Obviously, right? Potassium chloride blocks the potassium pump, leaves both the inside and outside with potassium. The membrane doesn't depolarize and there's no contraction. The guy during the autopsy won't be able to detect it because potassium, theoretically, we have it, not in a high concentration, but until they figure out what caused the death. Maybe by then the level has already dropped. I don't know, I'm just thinking out loud here, right? The substance, when administered outside of medical protocols, it doesn't even have to be a medical protocol, right? Anyone who has studied, who knows that electrolytes need to be balanced, it doesn't have to be a protocol, it's analysis, right? They analyzed it. The lab test, if it needs to be corrected, you just have to make a correction. It can trigger cardiac arrest within minutes. Even with the correct medical procedure, if you do it wrong, it can go badly for the patient. Imagine doing it without any indication for the patient. Imagine without it, right? Sources connected to the investigation say that the use of potassium chloride draws the investigators' attention because it's a compound that can cause death without leaving obvious signs at first, which makes it harder to identify the real cause of death and can simulate a natural or complicated death. The patient will have an arrhythmia, will go into cardiac arrest, the whole team will try to resuscitate, but they won't be able to because the problem is with the electrolytes. That's what will happen. If the person goes into a shockable rhythm, they'll try to shock, but soon they'll go into asystole, they'll do compressions, ventilations, they'll do everything and nothing will happen. Why? Because the pump is stuck. If the pump is stuck, man, there's no point in doing compressions, ventilating, giving epinephrine, nothing will work. The guy is stuck, you know? What you would have to do is, since it's stopped, man, it's going to be hard, but you would have to do it. Sodium chloride, 20% sodium chloride. What concentration would you have to collect a quick blood sample to check this during a cardiopulmonary resuscitation? I mean, it's hard, right? I mean, it's going to be very hard to avoid a death in this kind of situation. The first phase of the operation was launched on the morning of January 11th with support from the DPE. In this case, 2 suspects were temporarily arrested by court order. Search and seizure warrants were also carried out at addresses in Taguatinga, Braslandia, and Aguas Lindas in the surrounding area of the Federal District. The hospital commented on the 3 homicides committed by nursing technicians inside the intensive care unit in Taguatinga. The facility confirmed that it was aware of the case and reported it to the civil police of the Federal District, which advanced the investigations. The names of the suspects were not revealed by the police. So I got this from Metropole, right? People sent me a bunch of stuff here, guys. Come on, for God's sake, right, man? For God's sake, I stopped. Look, I'm recording here. Look, this is going to be some news that's coming up. It's a postgraduate course in emergency and urgent care that's coming soon. So I stopped recording because I was at lunch. A bunch of stuff came in here. I'm going back to recording. Anyway, guys, look, the other day, I think it was this year, right, that I recorded the nursing technician selling marijuana, and he got arrested there. Now, anyway, regardless of being a technician or a nurse, it's nursing, right? So this is really bad for us. It's really bad for the profession. Medicine is growing. It will have its problems in the future. Nursing has always had its problems with recognition and appreciation, and this only makes things worse. Man, because like this isn't human error. It wasn't a mistake. It wasn't the doctor who prescribed it. Someone did it and made a mistake, as we already have several problems regarding this. We're talking about a person who simply, in their right mind, took the high alert medication and administered it. You know what's going to happen? The nurses are going to take the blame. Mark my words, the nurses are going to take the blame. That's what's going to happen. Every high alert medication in a few days will only be administered by nurses. Mark my words. Later, if by any chance a hospital says we don't want nursing technicians here anymore, unfortunately, some pay for the mistakes of others. Soon, for various reasons, this could happen. Hiring is already difficult, but in a few days, hiring will become even harder. If you look at the person's background, the psychological test will have several things you might not even want to know about. If you know what this means, they want to know what you're like as a human being, how you think, to see if you have the capacity to do this. Nursing already goes into the depths of hospitals. Their bags are already searched, you know? And now, with this, just imagine how good this looks for our profession. I mean, as long as we keep saying, oh, nursing is undervalued. But look, it seems like there are some people who, for God's sake, just drag our profession down. All of this, drag it all down. Now, people start to get suspicious. For everyone in nursing, rebuilding the image of nursing is hard, but there's always someone who wants to mess things up and tarnish the profession. Every day it's getting worse. January isn't even over yet. Look at the kind of attention we're getting, you know? I hope this month ends without any negative attention for nursing because it's tough.